I got a stem cell injection for my knee. Real results with regenerative medicine. What's up, guys? Today, I'm doing something a little different. I'm actually the patient. I'm getting a stem cell injection in my right knee, and I'm taking you behind the scenes to show you exactly how we do it and why it works. So now, I've been doing CrossFit for over a decade, even competing at the CrossFit Games in 2012 and 2013. But now I'm 43. I'm starting to feel the wear and tear. My right knee, well, it's been flaring up with sprains, strains, just not healing the way it used to. So instead of just toughing it out, I'm using the same regenerative treatments we offer our patients right here at Abundant Health. One of the things that sets us apart is that we use something called bioscaffolding with our stem cells. Think of scaffolding on a building. It keeps everything in place so the work can get done. That's what this does. It holds the regenerative cells in place longer so they can repair and restore the joint more effectively. And after the injection, I'll be using a hyperbaric oxygen therapy, soft wave treatments, and BPC 157 to help those stem cells thrive even longer. Now, we often get asked, where do stem cells come from? These are Wharton's jelly stem cells derived from donated umbilical cord tissue after a planned C-section birth. And these tissues are screened, tested, and cryopreserved at negative 120 degrees Fahrenheit until they're ready for use. It's a completely ethical and safe process. And the regenerative power packed in each dose is absolutely incredible. Okay, here we go. Right knee. Honestly, the prep spray stings more than the actual injection. I don't even feel it.
That spray is actually way worse than what's actually going on. I don't even feel this thing happening. That's exciting. Heck yeah, let's go.
1 milliliter of stem cell combined with our bioscaffolding and done in under 5 minutes. This is an outpatient procedure, so I'll be back seeing patients in absolutely no time. Amanda is our nurse practitioner. She's been doing this since 2019. And some of the most common areas that she treats are, well, of course, knees, shoulders, plantar fasciitis, neuropathy, right, in the feet especially. And we even do IV infusions that affect the whole body. Very powerful for autoimmune conditions, neurodegenerative conditions, and just out of control inflammation. And again, it's not about just pain relief. It's about giving your body the support it needs to heal naturally so you can avoid cortisone or even surgery. So if you're tired of dealing with that chronic pain or been told that surgery is your only option, there is another path. At Abundant Health, we offer advanced regenerative therapies that help you get back to doing what you love. Drop a comment below if you've got questions. Hit that like button if this video helped you learn something new. And don't forget to subscribe for more real stories, patient success videos, and cutting edge treatments.